Hello, and welcome to Medicare, a guide to help you choose what's right for you. For those that are turning 65, or anybody still a little ways away from this milestone, or those newly eligible for Medicare, today will be a great chance to learn the ABCs and Ds of Medicare. Don't worry, I'm here to help you better understand the high points of this government program and so that you choose what's right for you. There are many options to consider when choosing your Medicare coverage. What's right for you may not be right for your friends or even your spouse. In other words, what you must figure out is really based on your specific health needs, not only today, but also in the future. Humana wants you to feel confident when choosing your Medicare coverage. Here's a few things we'll talk about at a high level. Facts about Medicare, your Medicare options, cost, important dates, and much more. Everybody clear with what we'll discuss? Let's get to the first question about Medicare. What is it? Medicare is a national health insurance program for individuals 65 years old and older and qualified persons with disabilities and certain illnesses. You may also be entitled to receive Medicare benefits through your spouse. Medicare has 4 parts, Parts A, B, C, and D. Part A and B are called Original Medicare. Part C is called Medicare Advantage, and Part D stands for prescription drugs. Let's talk about Original Medicare first. At age 65, legal U.S. residents are eligible for Parts A and B even if you still work. However, you may be entitled to premium-free Medicare Part A through your spouse, although you still must qualify for Medicare by age or disability. It's important to know you may also qualify for Medicare Parts A and B if you're under 65 and have a disability. Okay, let's take a quick break for some trivia. They're not hard questions. Which of the following singers is not eligible for Medicare? A, Peter Frampton. B, Bruce Springsteen. C, Phil Collins. D, Justin Bieber. Here's the answer. We don't know. The fact is, we don't have enough information to say if any of the musicians listed are eligible. It's not always clear who qualifies for Medicare. There's more to it than a person's age or where they were born. Original Medicare Parts A and B are what most people think about when they hear the word Medicare. Original Medicare is administered by the federal government. Part A generally helps cover hospitalization costs, and Part B with other medical expenses. If you or your spouse have worked a total of 10 years and have paid payroll taxes during that time, then you are entitled to Part A at no cost to you when you reach the age of 65. There is generally a premium you have to pay to obtain Part B. Medicare Part C is considered a choice in how you receive your Medicare coverage. It's easy to remember this. Just remember C stands for choice. Part C is also known as a Medicare Advantage Plan, or MA, and covers all the benefits of Original Medicare and more. Part D is for prescription drug coverage, D for drugs. There are 2 ways to receive your Part D coverage, and that's either through a standalone Part D plan or with a Medicare Advantage plan with prescription drug coverage included, also known as a MAPD plan. Simply put, you need a Part D prescription drug plan. Medicare Part C and D are administered by private health insurance companies, and you may have to pay additional premiums for this coverage. So what are all my options with all these parts of Medicare? Great question. One option that many people use is to have Original Medicare Parts A and B and purchase a standalone prescription drug plan, Part D. Since Medicare only covers 80% of your hospital and medical needs, many people also purchase a Medicare supplemental insurance plan to fill in some of the gaps in coverage that Medicare has. These Medicare supplemental insurance plans are also known as Medigap plans. This option is what you see in the top part of this graphic. Another option is to purchase a Medicare Advantage Plan, Part C. An Advantage plan has all the coverage of Part A and B, usually has Part D included in its coverage, and already fills many of the holes in Original Medicare, so you don't need Medigap insurance. It's one plan with all that coverage and even more, which we'll discuss in a few moments. Let's see if I can demonstrate this another way. Original Medicare is like a wedge of Swiss cheese. Good coverage, about 80%. The holes are what you end up paying. Deductibles, co-insurance, co-pays. You see this large hole? That's prescription drug coverage. Original Medicare doesn't cover it. Some people choose to fill the holes of original Medicare with supplemental insurance. The more holes you fill, the more it costs. But supplemental insurance still doesn't fill a big hole, which is prescription drug coverage. Some people choose to fill the holes of original Medicare with supplemental insurance, and then purchase a standalone drug plan to fill that large hole that original Medicare and Medicare supplemental insurance don't fill. It works. 3 cards and 3 premiums. Or, some people choose to have all the coverage of original Medicare and more. Fill many of the holes of original Medicare automatically and have prescription drug coverage already included. How? With a Medicare Advantage plan. 1 card, 1 premium, 1 company. Easy. Now that you know some of your options, now you need to know when you can sign up. Your initial enrollment period, or IEP, is important. This is a date based on your individual birthday or when you become newly eligible due to a disability. This is when you can begin to choose your Medicare options starting 3 months before you turn 65, the month in which you turn 65, and in the 3 months after your birthday month. In other words, you have a total of 7 months to make a decision. If you retire after 65, enrollment depends upon when your employer-sponsored coverage ends. Some of what I'll talk about now is good information for the future. 2 important dates for Part C and D to remember after the IEP is the annual election period, or AEP, and annual disenrollment period, or ADP. I know, a lot of acronyms. AEP is that time in the fall from October 15th to December 7th, when people can shop for Medicare Advantage plans and prescription drug plans. After that ends, you still have time to return to original Medicare. Generally, you can only make changes to your plan outside of these times if you have a special condition, like you've moved out of your plan area or now have Medicaid coverage. Now let's talk about your options and choosing the right plan for you. There's options to consider when choosing a plan that fits you. Medicare coverage isn't one size fits all. It comes in pieces, so you can tailor it to yourself. Anticipating what you need and knowing your options are critical to getting the affordable care you need to stay healthy. 3 important points to consider include: cost, how much you will be responsible to pay. Benefits, what do I really need, not just now, but in the future. Convenience, are the network providers convenient to you? Always think about your needs, now and in the future. Here's a short plan of attack. First, self-reflect and examine your current medical situation. If you're managing a chronic condition and/or taking brand-name drugs, your needs will vary greatly from someone who just wants to carry hospital coverage in case of an emergency. Think about the types of doctors you see, how often you see them, and where are they located. Consider the types of prescriptions you take and where you fill them. Try to anticipate potential future needs like medical supplies, surgeries, or nursing home care. What is your family's health history? Do you travel? Some plans only cover you while you're in certain areas of the country or home state. If you spend significant time away from home, you will want a policy that covers you both at home and while you travel. Plans change every year. If there are aspects of your plan that you depend on, be sure they'll still be available. Let's spend some time discussing your Medicare Advantage options. Here's some things to consider when choosing Medicare Advantage instead of original Medicare. You must have both Medicare Parts A and B coverage. You usually have to pay an additional monthly plan premium. You will remain a member of the Medicare program as long as you continue to pay your Part B premium. You may have the option for even more coverage, such as for dental or vision. This is called optional supplemental benefits, which is an additional premium. Let's take a quick break. Here's another trivia question. True or false? If you choose a Medicare Advantage plan, you must first enroll in original Medicare. If you answer true, you're correct. You must first be enrolled in both Medicare Part A and Part B before you can choose a Medicare Advantage plan. It's important to remember that if you choose a Medicare Advantage, you will still be in Medicare. You will still pay your Part B premium plus a premium for your Medicare Advantage plan, if applicable. With Medicare Advantage, even your choices have choices. You've probably heard the terms HMO and PPO a lot, but it's often hard to understand the differences in these two types of plans. Remember, there's no right or wrong choice when it comes to selecting your healthcare plan. Having a strong understanding of these plans and how they work will help you in choosing the plan that's best for you. Generally, an HMO, or health maintenance organization, has a primary care physician who helps arrange your health care within the plan's network of doctors, hospitals, and other healthcare providers. A preferred provider organization, or PPO, lets you choose any provider that accepts Medicare, although you may pay less for services within the network. You'll probably find most Medicare Advantage plans are either HMO or PPO. There are other types of Medicare Advantage plans. A private fee-for-service plan gives even more freedom of choice, but a network arrangement may still apply, and it may be one of the more expensive plans offered. Special needs plans, or S&P, is for people who may have a chronic condition, like diabetes. It may also be for those eligible for both Medicare and Medicaid. As I said earlier, you need to have Part D coverage. You can have a separate Part D plan if you choose to only have original Medicare. The good thing about Medicare Advantage plans is that your medical and prescription coverage can be combined into one plan. Keep this in mind as you choose your prescription drug plan. First, make sure the prescriptions you use are in the plan you choose. Second, you may have heard people talk about the coverage gap, or donut hole. This is when you pay a higher percentage of your prescription drug cost. You move in and out of the coverage gap when your total costs reach a specified dollar amount. These amounts are adjusted annually by CMS. This is something to consider, especially for folks who must take prescribed medications. Finally, the plan you choose may offer you less expensive alternatives to the drugs you're currently taking. Okay, here's another trivia question. Which of the following are not covered under original Medicare? A, foreign emergency care. B, 20% costs for doctor's office care. C, extended days in the hospital. D, all of the above. Here's the answer. D, all of the above. Something important to know about Medicare Advantage plans are the extra benefits. These plans usually include extra benefits and services, which may reduce out-of-pocket cost. Some plans may include fitness programs, vision and dental coverage, mail delivery pharmacy access, health education programs, nurse advice hotlines. Humana wants to help our members understand and achieve their best health. We've been offering Medicare Advantage plans to the public for over 30 years. In that time, we've learned a great deal, changing the way we provide health coverage. We are proud to say we currently have more than 3 million members enjoying Humana's all-in-one Medicare Advantage plan. This according to the Humana Inc. First Quarter 2016 earnings release, May 4th, 2016. We want to help you achieve your goals today, tomorrow, and many years from now. I want to call out some ways that Humana maximizes well-being. The Silver Sneakers Fitness Program members can use the equipment or take a class at one of the 11,000 participating fitness centers. For options outside the gym, try Silver Sneakers Flex, with classes like Tai Chi, yoga, and walking groups offered at local parks and recreation centers. Humana on-call nurses. Have a question for your doctor but can't reach their office? Call our toll-free number and get expert advice from a registered nurse any time of day. For emergencies, always dial 911. Humana Guidance Centers. At Humana, we believe in the importance of face-to-face relationships. That's why we've established guidance centers in a number of metropolitan areas around the country. There you'll find a dedicated staff and a calendar offering educational events, exercise classes, movies, and more. So, what is right for you? As we talked about, this is made up of a lot of different factors. We've only talked at a high level today about Medicare, but didn't get into plan-specific details for everything in your area. You may want to connect with someone who can answer your personal questions, like, is my doctor in network? Or, how much does something cost? A Humana licensed sales agent is available to answer your individual questions, give you further information, schedule a personal Medicare Advantage consultation. Call us Monday through Friday, 8 a.m. to 8 p.m. As always, if you have an existing sales agent, you should continue to work with them directly. Here are some other helpful resources, including www.medicare.gov that you can investigate on your own time. Thank you.